have a big audience. This is fantastic, so thanks for coming out. And thank you for the introduction. So I have about a half an hour. I have about 30 slides. I might move a little quickly. Please do come up and ask questions. You can either wait until the end or just come up, during the presentation. I got permission from Superintendent of Ashland Public Schools to share data that has not been publicly shared before, so it's a reveal for some of this data. And that's from the 2016 Ashland Adolescent Health Survey. I want to review who Ashland's Decisions at Every Turn Coalition is, if you're not aware of who we are, and then how we do our work, including both our local efforts and our regional efforts. We do a lot of collaborating, very collegial, so I think it's very timely to present on this topic. And then how can the Board of Health help to prevent youth substance use and abuse moving forward? And I will show evidence that the Board of Health has been very productive and active in this area historically, particularly around tobacco regulations. So thank you for that. So I just want to show some middle school data. So thankfully, middle school cigarette, alcohol, and marijuana use is very low. So, and it has declined over time. So this is in Ashland, and this is what we call current substance use. So it means they had to answer a question about their substance use in the past 30 days. So again, this is in Ashland, and this is Metro West as a region, and that's 25 towns in the Metro West Health Foundation catchment area. And this is alcohol. 3% of Ashland's 7th and 8th graders said that they had used alcohol in the past 30 days, and then 1% had said that they had used marijuana. So this is now, I'm going to switch to the Ashland High School data. And this is trend data, so it's data from 2006 to 2016. We now have 10 years of data collected every 2 years. I will start with the cigarette smoking. You can see the trends. So in 2006, about 17% of Ashland High School students said that they had used cigarettes in the past 30 days. And in 2016, about 4% said. So I think that's good progress, right? And then I'm going to go to marijuana next. So current marijuana use. There was an uptick in marijuana, which is not surprising given the climate around decriminalization. Medical marijuana was happening around that time. So up to 27% in 2010. And we've been working really hard given the current climate with policy. And we saw that in 2016, that was down to 18% of students reporting past 30-day use. So alcohol use has been a little more tricky. We are going to be prioritizing that moving forward. So in 2006, we saw 44% of students in grades 9 through 12 saying that they had used alcohol in the past 30 days. And that went down to 31% by 2010. And then we saw, unfortunately, a slight uptick, and hopefully we're back on a downward trend, so we won't know that until we do the survey again. Yeah, do you want the microphone?
I looked at the data there that you see the alcohol dipping down and the marijuana going up. Did they switch?
No. Nope, that's not a replacement that you're seeing there. And then this is just adding in what has happened across the region. So in Metro West, what happened with the numbers. So, for alcohol here, you can see that we were lower than Metro West for a bit, and we've kind of gone to be a little bit higher than Metro West. So we are working on that, and we are confident that we will be able to have a positive effect there. And then marijuana, we were higher than the Metro West region, and we are now lower. So, and then tobacco, we are lower than the Metro West region. So I think that's the kind of data that we like to see, and that indicates that our efforts are having a positive effect on youth substance use. Judy, do you have a question?
I think I may know the answer, but could you define use?
Did you say use?
Use. Is it just once? Is it
this
quantity?
It means that they have used it at least once in the past 30 days. This data, that's what this data is saying, and which is considered current use, and it's past 30 days from when they took the survey. Does that make sense? Yeah. Okay. Let's see. This is tobacco use, cigarette use, which I thought might be of particular interest to the Board of Health, since that's an area of regulation and policy for you. So what I'm showing here is cigarette and electronic cigarette use, and this is at, oops, sorry about that. Sorry, wrong way. Okay, in Ashland, in Metro West, in Massachusetts, and in the nation. So that's what this data is. It basically compares Ashland to the district, regionally, state, and national levels. So you can see our lifetime smoking levels are similar to the Metro West region, but much lower than Massachusetts and the US. Our current smoking levels are similar to the Metro West region. This is ever smoked daily, again, similar to Metro West. Lifetime electronic cigarette use, so that's 28% of our high school students said that they had used an electronic cigarette. It's concerning. So I think this is something that we all will continue to look at. There's some information coming out that says that the flavors, particularly of electronic cigarettes, are alarming because of some of the effects to the lung. Yes?
Does electronic cigarettes, does that include vaping?
Yes. Well, they may consider it as they're reading the question to be, yes, include vaping. And then the other is current electronic cigarette use. So within the past 30 days, how many students had said they had used an electronic cigarette? And we're slightly higher than the Metro West average at 18%. So I think this is particularly interesting. This is access to cigarettes, and this is, again, from the 2016 data. So of students who identified as current cigarette smokers, they were asked where are they getting their cigarettes. So 25% said that they bought them in a store in the town where they live. Something I think that could come out of this meeting, a public health related action item, could be to take a look at that, I think. And then the another statistic here is 17% said that they bought them in a store in another town. So I think we could be collaborative and work with surrounding towns to just check in with them and see where their compliance rates are and things like that. This is access to electronic cigarettes. And so 52% said that they borrowed them from someone else. Not a lot that you can do about that. And so only 7% said that they bought them in a store in town, and 10% said they bought them in a store out of town. So with the opioid epidemic kind of top of mind related to substance use issues, I wanted to include some opioid-related data from the survey so you could get a feel for where our students are at, our high school students. So lifetime prescription drug misuse, this may or may not be opioids the way that it's listed on the survey. It might also be things like ADHD medications that they're misusing, stimulant medications. So this is, again, Ashland, Metro West. It would be Massachusetts and the nation. So we are similar in lifetime prescription drug misuse to the region, similar in current prescription drug misuse, which would be past 30-day use, similar in lifetime stimulant misuse, similar in lifetime opioid misuse, slightly lower prescribed an opioid by a healthcare provider, and then lifetime heroin use, similar to the region and the state and the nation. And I know that is particularly alarming considering the age of the students that we are talking about. So for anyone who doesn't know the brain science behind it, I'm just gonna really top level say that all drugs of abuse, so alcohol, tobacco, which would be really nicotine, and other drugs, including opioids, stimulants, they all increase brain dopamine in the reward pathway, which and the pleasure center of the brain is considered right here, the nucleus accumbens. And so they all act on either directly or indirectly on that area of the brain. So for adolescents, the reward system is particularly active in the teen brain. They're seeking novel experiences. They're forming new connections. And what we say, the prefrontal cortex of the brain, which kind of is that control center for decision making, is developing. That doesn't mean they are not capable of making good decisions, because they are, and we can expect them to make good decisions. But by teaching them how to do that, it's very important. And so, but the connections that are being made in the brain, the ones that are most repeated, form the most efficient connections. So it's really important that we try to prevent youth substance use. Mark, do you have a question?
Yeah, I have a question. I'm basically this part here, because years ago I kind of had a little bit of an action adventure with my health. I'm going to tell a story before I ask the question. I want you to relate, hopefully, Amy, and your group, what could happen. If you, I'm just talking alcohol, but it could be anything that affects the brain. If you go overboard for years, the brain nervous stem cell shrinks, yes? Oh, no.
Are you asking me that
Yes.
question? There's actually a lot of complex things that happen in the brain when when the brain is exposed to substances.
Okay, so Ed, alcohol is a drug. Alcohol can permanently damage brain cells if taken to excess. I'm going to say quickly what I went through, so we'll keep on going. On September 7th, 6:35 to 7:05 a.m. p.m., I was watching television. I was an active alcoholic back then. I tried reaching for a bottle of beer to watch TV. All of a sudden, I fell. So I was shaking, having convulsions. Ended up at the old Midwest Hospital, which is now what it is now, with what could be fluid things coming on my hands and getting myself fluidized. I had a brain seizure. This is what could happen if nobody catches up.
Thank you for sharing your story, Mark. Since you talked about alcoholism, what people are talking about is the lifespan of young white males is actually declining, partially related to the opioid epidemic, but actually partially related to liver failure associated with alcoholism. But it's not getting a lot of attention right now. So thank you for mentioning your story. So dependence on substances is highly correlated with early use. So this is why we really strive to prevent youth use of substances, because 40% of those who begin drinking at age 15 will develop an alcohol use disorder, compared to 7% if they begin drinking at 21. Many experts now consider substance use disorders a pediatric disease because it develops early during adolescence when youth first start using substances. So this brings me to our coalition, the Decisions at Every Turn Coalition. We are a group of dedicated volunteers. I'm going to call out Betsy here. Betsy is a very dedicated volunteer with the Decisions at Every Turn Coalition. And we are dedicated to creating a safe and healthy Ashland by working as a community to prevent, reduce, and solve the problems that can lead to youth substance use. In what we call the behavioral health continuum of care, prevention falls to the left on the continuum of care. This is behavioral health promotion and prevention before people need treatment and then support with recovery. So we really strive to enhance people's coping and resiliency and all of the skills that they need so that prevention is where we're putting our effort, and hopefully over time we'll have to put less effort into treatment recovery, which are also extremely important, so I don't want to minimize that. But I just want to mention this quote. I recently was in Washington, D.C. at the Community Anti-Drug Conference of America, or Coalitions of America Conference, and a senior policy consultant said, we cannot treat our way out of the opioid epidemic. It cannot be overstated. I mean, we need to be putting effort into prevention if we're going to make headway long term. So our coalition is fortunate to apply for and receive a federal drug-free communities grant. That funding is through the Federal Substance Abuse and Mental Health Services Administration and the White House Office of National Drug Control Policy. So we receive $125,000 a year. We're just finishing up year 4, and then we'll have year 5, and we can reapply for an additional 5 years. And we have to put forth a one-to-one match. So we have to match $125,000 in cash or in-kind donations. Thank you to the Board of Selectmen because they contribute to our cash match through a BAA grant during both cycles, the fall and the spring cycles. But what we do is we mobilize community leaders to identify and respond to substance use issues that are unique to Ashland. And hopefully we are able to create change through the entire community. Here I just wanted to highlight that our coalition, as eligibility criteria for this grant, requires that we have signatures from 12 and representation from 12 sectors in the community. Now we partner with well beyond this list. But I want to publicly thank everybody that is on this list and who has signed on their support and has worked with us diligently in our youth substance use prevention efforts. Okay, and so all I want to say here is that investing in comprehensive, multi-strategy, long-term prevention approaches yields the greater return on investment, which is why DFC invests the way that they do. And we do have a process for this. It's called the Strategic Prevention Framework, and it's a cycle. We are constantly working, using this framework in our efforts. So the 2 goals of our federal drug-free communities grant, one is to increase community collaboration, and the second is to reduce youth substance use. And we use the collaborations and partnerships that we create in our efforts. This highlights kind of the spheres that we have of partnership and collaboration. There are so many, too many to name. It really is a joy to be a part of this work, and I really, really want to thank everybody who contributes. So we are required to choose multiple substances to focus on. So we have chosen tobacco, alcohol, marijuana, and prescription drug misuse. We are required to collect data on past 30-day substance use, which I just mentioned. We also are required to collect data on perception of risk or perception of harm, perception of parental disapproval, and perception of peer disapproval. And the reason for that is that, as it is well documented in the literature, that as youth perceive a low risk of harm, they are more likely to use it. If they perceive a low parental disapproval, which means if they think their parents think it's okay if they do it more. And if they perceive that their peers think it's okay, they do it more. So that is why we are required to collect these data. So this is just a summary, essentially, of the data that I showed you previously. We had a 5-year strategic plan that we presented in our grant application. This is how we are doing with the measurable outcomes that we said we would achieve. Yeah?
Quick question, the prior slide. Was peer
actually parents play the most important role in whether or not students or youth choose to use. And we do have data. I would love to come back and share that. We say there's a question about how important are your parents in your decision whether or not to use. And so and then how important are your peers in your decision whether or not to use. And many times more often students say that their parents are the most important. Another interesting, I'm just going to say it because it's really interesting, fact is that when they choose not to use, they choose not to use because they don't want to harm others. So I love that. Like, they don't want to hurt anybody else, right? I like that statistic. Anything else? Okay. So as I mentioned, in terms of our measurable outcomes, we have actually, assuming our data continues on a downward trend into 2018, because that's the year in which we set our outcomes for, we said we would reduce our tobacco 30-day use by 5% to fewer than 11% of age students by 2018. We've already met that goal. So assuming it continues downward, we will more than have achieved that. Marijuana, we're not quite there. We said fewer than 17%. Right now we're at 18%. And then prescription drug 30-day use, we have achieved that. I showed you data that said that they were at 4%. So I am hopeful that our numbers will continue on a downward trend, other than alcohol will continue to work diligently there. Yes?
How can you be certain of the honesty of the students who take the survey?
That's a really good question. We get it very often. The participation rate in this survey is about 90%, which is very good. And the Metro West Health Foundation pays for the survey. They do it across the 25 towns, as I mentioned. They contract with the Education Development Center, a very skilled research center. Well, they do a lot of things, but one of them is evaluation. And so what they do is they look for inconsistencies in the surveys, and they actually go through and they take out any survey that, they have an algorithm for it that looks like it was not done with fidelity. It wasn't done honestly. And they can't obviously go through every question, but they can look for patterns and inconsistencies in their responses and things like that. Yeah. Yeah, when there have been studies done on that actually, and the perception of youth is that their peers aren't answering it factually, but they say that they are. So that's kind of how the perception is. And this is just the trend graphical line graph of the data that I just showed you, which is essentially what I showed previously. Okay, so this is just some of our key 5-year accomplishments. There are so many, I'm not even gonna go through them. Very pleased with this, and our DFC grant supports 2 staff, so I do wanna give a shout out to them as well. So Kristen French is our community outreach coordinator. I know she's worked with the Board of Health, and she's had interns on the Board of Health that she's worked with, and I think she's gonna be working with the Board of Health's current intern. And then we have a new coalition coordinator, and her name is Salmia. I do want to highlight that we have working groups we have an opioid prevention working group working very hard on our opioid prevention efforts. We have many other working groups. Betsy knows 2 of them well, which are our community programming working group and our social norms working group. We have been doing over the past several years a social norms campaign at the high school level, which highlights that most students are making good choices. Most students are not using substances. So we want to grow that. That was back to my grow the positive comment. That's where that comes from. So we are hopeful that all of our collective efforts, all of your collective efforts with us are having a positive effect. I did want to, if there's time, I did want to just show the opioid data. This is not youth, but this is unfortunately. This is deaths and Narcan uses. This is data that our opioid prevention working group is using. Let's see, here is the number of opioid-related overdose deaths by Metro West communities, and this was from the Massachusetts Department of Public Health, 2012 to 2016. It was posted on May of 2017, and it comes from the Metro West Health Foundation website. So here's Ashland, 2012, 2013, 2014, 2015, 2016. So you can see that over 2014 to 2016, we had an 2015, we had an increase to 5, and then 2016, 4. In 2017, to date, we had 1 death, and the Ashland Police Department has administered Narcan, I believe, 8 times this year. Yes. Yes, this is the police department. This is the police department. I don't have the fire department data here. I mean here, right here. Okay. And then this is Metro West opioid-related hospital visits by city and town. And this was in 2014. That's the most recent data that we have. And there were 76 opioid-related hospital visits from Ashland residents in 2014. Yeah. Well, if it was an opioid, then it would show up in this bucket. So my point on that section, I think I've made my point very clear, is that collaboration is key to the effort that we do. There are prevention specialists and experts that are trained in the strategic prevention framework and that utilize evidence-based prevention practices, whether they be programs or policy change and things like that, that we know work in prevention. So I just wanted to take a minute to mention that not only do we work in Ashland, we also are fortunate to work regionally with some tremendously talented and fantastic prevention experts. We work across the Metro West region with the Metro West Substance Abuse Prevention Alliance. With the Metro West Substance Abuse Prevention Alliance, we have done the Metro West Youth Teaming Together Summit, which was a summit that brought youth together. We had about 8 towns participate. The students broke up into groups, and they told us what they thought would work for prevention among them and their peers. So we are excited to move some of those projects forward. We did the Hidden in Plain Sight exhibit at the Natick Mall, was our first project together with them. That was in the prior year. We also work collaboratively. Ashland is part of 2 state-funded grants. The first is the Metro West Substance Abuse Prevention Collaborative, the SAPSI, which focuses on underage drinking. And the other is the Metro West Massachusetts Opioid Abuse Prevention Collaborative. They focus on harm reduction and also opioid abuse prevention, primary prevention. And then I did want to highlight that the Board of Health has been very proactive in tobacco regulations, that our health director and several Board of Health members attend both our coalition meetings when they can and also regional prevention meetings. In the future, I would love to see us all continue to collaborate on additional enforcement and policy. And then, meetings like this where you help us to share information with the community, I think is very helpful. I think that's all I had. Thank you. Oh, go ahead, Steve.
Amy, thank you. Really, really good presentation. Thank you. So your understanding of the information relative to opioids, that seems to be the biggest kind of critical mass going on right now. Is it your understanding of the information relative to opioid use as a result of legitimate prescriptions for injury versus kind of moving up the substance food chain?
Yeah. So the question was, let me rephrase. Let me say it back to you, and you can correct me if I'm wrong. Are the majority of people who are have become opioid dependent and maybe are now using heroin or fentanyl, either knowingly or unknowingly, did they originate with a legitimate pain prescription? That's your question. I am going to say that no. The majority came to opioid misuse, not through a legitimate pain prescription. That has happened, and there is definitely misuse. But I think that there has also been a lot of diversion of opioid prescriptions because there was just so much overprescribing, right? There's just a lot out there, which increases accessibility, which is a key metric that we know lends itself to substance misuse. Did you want to add anything to that?
No,
Okay. I was asking Ed behind you if he wanted to add anything. But yes, that obviously has also been a concern. Do you want the microphone?
No, I'm going to come up.
Okay.
This is something near and dear from my previous life.
Are you dead?
I'm not dead, but my previous career as a police officer. Back in 1991, we started a youth diversion program and a drug program that lasted 11 years in the town. It progressed into a bigger and better thing. We went into other schools in town. And for you folks to take the torch, I think it's a great thing. It should have been continued, but it didn't. It takes a lot of work. And you have a committee that you have, and unfortunately, I was just one out of many that had to do it. So I'm greatly appreciative of the work that you and the coalition is doing. One of the questions that I had was that in looking at your survey results and trying to rack my mind about the survey we did over 20 years ago, the smoking doesn't seem, it's like almost dead even from what we had 20 years ago to what we have now. And one of the things that we questioned was whether or not, you talked about they didn't want to hurt other people, and that was one of the things that, if I'm with my friends, I'm not going to do something that they don't approve of. And so I see that trend is still there, so it's in the back of their mind. So if you continue promoting that, that's the way to do it, I think. Yeah. But thank you for all your efforts and those people that work behind the scenes. Thank you. It's only the betterment for the community as a whole. These are the issues that need to be addressed. Thank you.
Thank you. Yes. Do you want to put on a microphone? Okay.
So I've heard that you can get Narcan at CVS without a prescription. Is that true? And why is that?
Yes, that is true. And it's true because Narcan is so effective. Oh, sorry. The question was, is it true that you can get Narcan at CVS without a prescription? And yes, you can walk into CVS and I believe you have to go to the pharmacy and say that you would like Narcan. And they are supposed to give it to you because it is a life-saving measure, right? If you are living with someone who has an opioid addiction, you're in a relationship or you have friends, and if you have Narcan, you could save their life. So it is a harm reduction and life-saving measure, yes.
So I've also heard, and I don't know if this is true at all, but they found it in the state park, where that sounds like people are just...
Did you say Narcan?
Yeah.
I don't know. I haven't heard that. That they have found Narcan in the state park. Do you mean like left there in case somebody needs it, or it was used there? Yeah. I don't know. I have not heard that, but that is not surprising to me. Yeah.
Amy, it's a timely question, so if I may, Mark Oram, Board of Health Agent Director. First of all, I'd like to recognize also Sergeant Ed Berman. He's been very helpful in all this. He has an excellent presentation, as yours was, on the use of Narcan as well as opioid abuse. The timely question was just today. Kristen French, who you mentioned earlier, as well as our new intern, Stephen Hines, and myself, we all sat down to discuss a certain project by the acronym of MOON. And it actually was discussed about Narcan at our CVS and Rite Aid pharmacies. And the fact is that we are trying to promote people to understand that it's available. I'm glad you asked that question. It's available for people to go and not feel any stigma. And I'm glad to hear from the police as well that, you know, these are people that are needing help. They're not criminals. And we have to take the stigma away. As you know, we talk about that constantly. And our intent, and the Board of Health will meet the intern at our next meeting or within the next month, is to get back to the pharmacies with this notification that here's a process to follow, and hopefully they will work with allow that feeling that you can go in and feel free to ask for Narcan in a comfortable location within the pharmacy, not maybe in line, because the stigma is still, unfortunately, until we continue to educate, will be there, but to allow people to realize if there's someone they know, someone in their family, we could possibly save their life. Thank you.
Yeah, thank you. So I think that's a really important point. The town has recently brought on staff. I believe her current title is Health and Human Services Director. Well, it's intake specialist, I think, for the time being. It may change to something else. But she can help, too. She can help people find services and supports that they might need, whether dealing with a mental health or substance use issue. Yes, Betsy?
I just want to add, follow up what Mark said about
to follow up on what Mark said about reducing the stigma and Narcan, access to Narcan. It's really important for people who are struggling with addiction to opioids that they have as many chances to get into recovery. And a lot of people who struggle with substance use disorder need many chances before they get the right set of resources to achieve long-term recovery. So we want to help them.
Yes. I have a couple of questions that would be timely, hopefully. When you took the surveys and you got all the answers, was there any places other with an explanation or comments were put down to?
No, there was no place, there were no open fields where students could just make comment. No.
Okay.
I know those are very interesting. They're hard to analyze because it's a lot of data to get through, but we will be putting out a parent survey soon, and we do have places where parents can do that.
And then I remember when this actually first, as Joe said, hit his time, there was DARE, and there was the first decision at every turn with Joe Muto, at the high school counselor. That was since the high school was being done. Mary, you might know from the nurses that he was a counselor in there and had hit the same sort of meetings.
Yeah, I know. I do know what you're talking about.
And this is an expansion.
Yes, that's
basically.
right. That's correct. Yes, it is.
Yeah, he was here for 3 years.
Now, the question is that hopefully an opinion from your group. The cannabis bylaw, what's your group's opinion on that, if you can say in the open?
She can.
Our coalition cannot take a position on that because we are federally funded, so we are prohibited from lobbying. As a personal resident, if you ask me later, I will give you my opinion. And many are laughing because they know my opinion as a personal resident.
So the State House cannot be still an open vote because all the opinions have not been there. Thank you.
The question you're asking goes to what I was talking about earlier about accessibility and attitudes and perceptions. Yes?
What role does mental health have in the program?
So, did you say what role does mental health? Did you say
Is there any initiatives regarding mental health within the program?
Yes. So I mentioned on the far left of the behavioral health continuum is behavioral health promotion. And what that, if you break that down, that is really getting at ensuring that people, either they're adults or youth, have the supports they need for positive social emotional learning, social emotional development, and mental health. Because really what it comes down to is if people have the skills, the coping skills, the resilience to deal with stress, anxiety, depression, and other mental health issues that might arise, either from trauma or something else, then they're less likely to use substances. We have a social, emotional, and mental health working group as one of our working groups, and they are going to be meeting, I think, here at the beginning of the school year. And we have a lot of school staff and administration that sit on that, among many other people from the community. I think Betsy sits on that too. And I think they're going to be developing, one of the community programs and thinking about how to better promote positive social, emotional, and mental health moving forward. I can say that the school is doing a lot of work in this area. They are working hard to develop a K through 12 health and wellness curriculum that includes social and emotional learning as an element of that. And they have tremendous, counseling staff, and they're really taking a good look and trying to do a lot of work in that area. Yes. Betsy's saying every year some of our community programs are focused on mental health or social emotional, different aspects of it.
We don't want to cut off questions because this is really terrific. What you do is terrific, and I think you're commenting on the involvement of the school. There are so many people in this community who are gravitating to this. The schools are obviously doing a terrific job, the parent groups and actually just the volunteers, because we're involved with all these grants, and it's really great working with the other communities too. So I wanted to thank you, but I want to thank everyone else and make sure that if there's anybody with the last couple of questions, they have an opportunity to ask those questions before we kind of call it. And because I just want to add one last thing before I basically sit down, is that please come back. We know that there's so much more here that we can share.
Yeah. Did you have a question?
When we spoke the first time, I was certainly completely uninformed. So I have a question regarding a potential process, because I think you've spoken about this in the past. If there is to be a ban in the town or a vote either way, how does that process work from your knowledge of other communities?
Yep.
It can't, I would assume it can't just be a unilateral position by 5 people on the board or selectmen.
Yeah.
So what is that process like?
So there are it's just factual information I am providing. The way that communities have already opted out, and there are at least 40, if not more, the way that they have done it is they have followed the language as it read in ballot question 4 to the letter, which means that they have held this is for towns that have a structure with a Board of Selectmen town meeting. They have held both a town meeting vote, so they put it on as a warrant article, and to have an opt-out. They have also done a ballot vote, so it had to be either a special election or at a ballot election. Moving forward, it's uncertain what the process will be, whether communities will have to stick to that process, because the Senate has put forward an omnibus bill that has come out of the Joint Committee on Marijuana Policy, and they kept that process intact, whereas the House bill moved it to say that Board of Selectmen could put that on the town meeting warrant, and then communities could vote on it there. So it's unclear moving forward what the process will be, but it will be one of those two processes.
Sounds like the entire community is involved in making that decision.
Yeah.
Not just
Correct.
It has to be decided by Friday.
I know, June 30th, that's the date.
Amy, if I could, one, we're lucky to have you and the asset and your organization, so we're very, very lucky to have you. As you're aware, I've been actively working on the state level and the federal level with this. You know, President Trump started his opiate task force and put Governor Baker on, and Governor Baker has invited me to join. And I go to all these meetings, and everybody there cares and is concerned and is worried. And I thought Betsy brought up the good point, is until we get past the stigma, I really fear that we're not going to get, your next door neighbor, your best friend could be a drug addict, and that's okay. You know,
Yeah.
it's terrible, but it's okay. And until we get past that stigma. But what I get concerned is, you know, as I go to these Rotary meetings all across the country, or I go down to DC and work on these task force or work with the governor, and I talk to all these opiate people, it's always access. Because you could become a heroin addict tonight. You've never done a recreational drug in your life, and you could become a heroin addict tonight because you made one bad decision.
Yes, that is the exception.
It is the exception.
Rather
And
than
that's what I wanted to say. It is the exception.
And there's data to show that.
Yes.
Typically, you know, it's not that people just pick up an opioid and start using an opioid. Typically, they have, and there's a lot of debate about, and I know the term gateway, and I'm not using it because there is a lot of debate about it. So typically, people don't just do that. Yes, the accessibility is extremely, there are a couple things. The accessibility, and I was just with representatives from 3 DA offices from 3 counties today. We had a lot of discussion about this. The accessibility of prescription opioids is coming down. That's a good thing over the long term.
Right.
In the short term, that may push people towards heroin because they are less able to access the prescription opioids. So your point about getting, which is extremely concerning in part because now we know that there's a lot of fentanyl that's making its way into heroin, which is contributing to either first responders having to use a lot of Narcan to revive people, or people dying because of the potency of the fentanyl. So it is absolutely critical. I think we've been talking, though I do focus on primary prevention, which is preventing first use. Or delaying first use. We are, with our MOPC grant that I mentioned, the regional grant, they just held a harm reduction opioid forum. I think Judy was there for at least part of it. Mark, I think you were there.
Too, yes.
And talking about meeting people where they are, right? You can't, oftentimes people want to force people into treatment, and the people around them may want that to happen. And if those individuals aren't ready, they need to be met where they are. There are a lot of harm reduction strategies, and harm reduction encompasses a lot of things, and some people are comfortable with some and not with others. But I think meeting people where they are at and asking them what they need. What do they need? Do they need a job, help finding a job? Do they need help finding a home? Do they, I think these are questions. I'm so proud of Ashland because I do believe we are a tremendously caring and welcoming community. And I think there are a lot of just citizens who would reach out and ask them, what do you need? How can I help you? And I think that's something important to remember.
I think it's interesting that you and I kind of ended up, because that was my original point, is I go to a lot of these meetings, everybody's concerned, well, what do we do? Yeah. Where do we start? And you start just right there. And you also write a letter to your lawmakers. You write a letter to your kid's pediatrician. You write a letter to your doctor.
Yes.
You write a letter to your local board of health. And I'm not just talking Ashland, I'm talking globally,
Absolutely.
I'm talking national. Because you go to these meetings and everybody wants to do something.
Yep.
Yet, here we still are.
Yep.
And until we start doing that, we're always going to be where we're at, unfortunately.
I think we are, and I don't know if Ed doesn't really want to say anything. Sorry, Ed. We are making we are making progress. It's slow. And
But
so,
it is progress.
but I do think there's progress. There's obviously a lot more to do. This work can be exhausting, those of you who have done it, because it always feels like you're not doing enough. But
The hour is getting a little later,
yeah, sorry.
and we want you to come back. But I also want you to plug your website,
Yes.
because I think that's a great place for people to connect. And also, from where I sit, I see that there are a lot of people volunteering, but hopefully you've stimulated some also extra interest.
Yeah.
So suggest to anyone watching, if they want to either know more or maybe contribute in a more proactive way, how they can do that.
They can go to our website, www.ashlanddecisions.org. There, through that website, all of our email addresses are there, and I think there's even a button to contact our coalition, and that will go to our staff.
The meetings are flexible, and
Yeah.
we know that there's at
everything's
least
posted.
3 or 4 a month. So
Yeah.
different options.
No, thank you, and thank you so much
Yes.
for having me here. Really, I appreciate
Okay.
it, and was happy to do it. So thank you.
you.